So how is this reality being confronted by the White House, and what does it mean for Black and Hispanic Americans? Up front with us now, Derrick Johnson, president of the NAACP, and CNN political commentator Van Jones. So Derrick, let me start with you. U.S. Surgeon General Jerome Adams addressed communities of color today. You know, he's been talking about how his upbringing has made him more susceptible to getting extremely sick from this virus. Today, he used some colorful language talking about the overall issue. Here he is.
Avoid alcohol, tobacco, and drugs. And call your friends and family. Check in on your mother. She wants to hear from you right now. And speaking of mothers, we need you to do this, if not for yourself, then for your abuela. Do it for your granddaddy. Do it for your big mama. Do it for your pop-pop. We need you to understand, especially in communities of color, we need you to step up and help stop the spread so that we can protect those who are most vulnerable.
And Derrick, when he was pressed on it, the Surgeon General says he's been speaking with you about how to best address this issue and to target outreach in the Black community. Here's that exchange.
Could you talk about whether or not could you, I guess, have a response for people who might be offended by the language that he used?
Well, I use that language because that's the language. I've been meeting with the NAACP, with the National Medical Association, with others. I actually talked with Derrick Johnson multiple times this week, the head of the NAACP, and we need targeted outreach to the African-American community, and I use the language that is used in my family. That was not meant to be offensive. That's the language that we use and that I use.
Obviously, that exchange a bit tense there. Were those comments part of your discussion, Derrick?
Well, let's be clear. What we're looking at now is a pandemic that was made and created, not because of individual personal behavior, but because policymakers, as in the White House right now, did not take the necessary precautions to ensure that all citizens of this country were protected. It is man-made because we have defunded the key aspects of infectious diseases. It is man-made because we have refused as a nation to expand Affordable Care Act so more Americans can have access to health care. It is man-made because of the social conditions that many people live in. So I don't want anyone to ever think that this is about their personal behavior, when in fact this is public policy that has gone awry because we have not taken all citizens' health into consideration when we're making policy decisions.
So I want to get to the behavior part in a second, but just as a follow-up, are you okay with the way he said it? He said, these are the words that are used in my family. When he said abuela, granddaddy, big mama, pop. You did not find that problematic?
Well, it's about the podium you're using when you're having the conversation. It is a presidential briefing, is not a community or family discussion. And I think that's what people are reacting to. But let's be clear. You have bus drivers in the city of Detroit who have died and others been affected. You have sheriff deputies who are being impacted. You have families who cannot go to work. And we need to focus on the impact this virus is having on our communities. And as a result of public policy, not individual behavior.
So, and Van, to that point, we understand that part of the reason, right, that you have, in Black and brown communities, some people are getting much sicker, right, is in part because they're in jobs where they have to keep going to work, right? When Derrick's talking about bus drivers, and these are people who are going and putting their lives on the line every day now to go to work. And it's also because of policy decisions and healthcare decisions, pre-diabetic and diabetic issues, right, that exist way before where we are now. But the Surgeon General today said Black, Latino, and other people of color, quote, should avoid alcohol, tobacco, and drugs. You heard that at the very beginning of his soundbite. Avoid alcohol, tobacco, and drugs, and call your friends and family. Check in on your mother. What's your take on those comments? Obviously, alcohol, tobacco, and drugs are would affect anybody negatively, whatever your race. And also, to Derrick's point, they are personal behaviors.
I'm glad he said what he said. Let me be very clear. The NAACP is 100% correct in that we have an epidemic already of neglect in communities, and we have an epidemic already of hypertension, of obesity, all those different things. And so you have a pandemic jumping on top of an epidemic. We have an epidemic of bad jobs. They now call them essential jobs, essential workers. They weren't paid as essential workers. They didn't have the rights of essential workers until this very, very moment. But I want to be very clear about something. I am glad that some of these officials are trying to break through to communities that have not gotten the message. A lot of the stuff that we have been saying has not been helpful. When we talk about comorbidities and this sort of stuff, that's not how regular people talk. Regular people talk, hey, do you take a pill every night? Do you take a pill every day? Then you could die from this. It's not just about older people. In the Black community, we're seeing people die in their 50s, in their 40s, and in their 30s, and even younger, because we have high blood pressure. We have an epidemic of that. So you got to say, hey, do you have pressure? You could die. I don't care if you're 30 years old. Do you have an asthma inhaler? You could die. I don't care if you're 40 years old. And when you start talking that way and breaking through, do you got sugar? We call it diabetes sugar. You got that sugar? Do you have that pressure? You can criticize somebody for saying that, but somebody's going to listen to that differently and make a different choice. It's both public policy. It's also, and now in the light of the failure of public policy, we have personal choices. And I think it's important that we stop this highfalutin language that most people cannot understand. And one more thing I got to say is this. Please understand, there's an epidemic of ignorance about this virus. It's not just in the Black community. We have white governors that will not do the right thing by their own states in the South. But the reason we're focusing on Black and brown people is because in our community, the consequences of not understanding this virus are so high. We're the ones that are dying. And so it is important. This is not playing a race card. It's playing the data card. According to the data, we're the ones who are dying. So those hot spots, send in masks, send in respirators, send in tests, and use language that people can understand. I'm not going to criticize anybody for trying to reach out when we're dying in these numbers.
Derrick?
Well, I absolutely agree. And you talk about data. We are consistently saying to the CDC, release the data. We need to understand who's been impacted, where they're being impacted, so we can identify the necessary treatments to address this pandemic. For whatever reasons, this administration has refused to do so. But it's critically important that we get the data so we can understand how best to navigate in this pandemic. If we don't have data, we cannot isolate where the problem is taking place, control the spread of the virus so that we can come out of this, the economic realities that we're looking at right now. As a result of bad policy decisions, individuals, yes, they have to make personal choices, but unfortunately, those personal choices have devolved to whether or not we're going to have enough food on the table because we no longer have our job and we cannot get through to the unemployment office because the ones answering the phone. I will continue to talk to healthcare experts and professionals because the politicians have failed us. And so my conversation with the Surgeon General is like it is with the National Medical Association, because as African Americans, we have to come up with a solution to address this because government is failing us as the same way they failed us during the Hurricane Katrina.
All right. Derrick Johnson, Van Jones, thank you both very much. And next, state governments want to know if you're really obeying stay-at-home orders. And now some of them are going to be working with tech companies